Care Coordination Presentation. Hello, my name is Grabowska, and I would like to thank all of you for having me today. I am a registered nurse, and I am also a care coordinator in this community care center. In this presentation, I will be discussing fundamental principles about care coordination, how it influences patients and family members, and its impact. To begin with, I would like to present what care coordination is. Care coordination integrates providing a patient's medical care by various specialists and providers, by preventing treatment from different providers from being delivered in soils. Coordinated care aims to improve health outcomes and lower costs by doing away with unnecessary tests and procedures. Several components are necessary for effective care coordination. Having quick access to a variety of healthcare providers and services, effective provider transition, and good communication regarding the treatment plan, a concentration on the patient's overall healthcare requirements, information that is basic and easy for patients to understand, effective strategies to achieve desired outcomes through patient collaboration, an expectation of high-quality patient care is efficient care coordination and transition communication. Inefficient care coordination and poor communication during care transition lead to adverse occurrence and risk exposures. Undertreatment, inadequate therapy, adverse medication events, and hospital admission or readmission are caused by lack of information sharing between healthcare professionals and poor interprofessional communication. 1 in 5 patients leaving the hospital experience an adverse event, and up to 49% of patients face at least one medical error after leaving. Up to 50% or more of this occurrence might be avoided with improved provider communication. To move beyond concern for care for the encounter or stay and toward care provision and coordination across the continuum, dialogue between nursing leaders, faculty, students, and other healthcare providers is crucial for curriculum redesign. What is more, all people receiving care have benefited from collaborative and person-centered methods. People who are actively involved in their care have better clinical outcomes. It includes being less likely to use emergency hospital services, being better able to manage complex chronic condition, asking for the right help, feeling less anxious and stressed, and staying in the hospital for shorter periods. Person-centered care is particularly advantageous because it encourages people to participate actively in their care. If they received person-centered care, patients are more likely to follow their treatment regimens and select less invasive and expensive procedures. Lastly, to enhance care coordination is the improvement of academic practice partnerships. This collaboration must go beyond agreements between academic institutions and businesses to host student clinical placements and instead focus on how best to prepare recent graduates to satisfy the demands for care across the whole healthcare spectrum. This aspect is crucial if nursing education transcends the confines of acute care focused clinical experiences for students and other care soils. Additionally, it is significant that nurses who are already working know about care coordination and the role of nursing in promoting a smooth transition by standardizing education with the healthcare industry. Change management that affects the patient's experience. Technology improvement, aging population, shifting disease patterns, new medical discoveries from treating disease, political changes, and policy initiatives are all causing a constant change in healthcare industry. Changes might be complex since they go against people's natural need for a secure environment. However, when healthcare personnel have the chance to influence the change, feel ready for it, and see its value, including the benefit to patients, organizational changes in the industry are more likely to be successful. Coordinated care plans based on ethical decision making. The American Nurse Association highlights the importance of the Nursing Code of Ethics and describes it as a guide for carrying out nursing responsibilities in a manner consistent with quality in nursing care and ethical obligation of the profession. Ethics generally refers to the moral rules that guide a person's behavior. All healthcare professionals must uphold ethical standards, but these values are crucial given that nurses provide care. The Nursing Code of Ethics is based on four key elements: autonomy, recognizing each patient's individual rights to self determination and decision making. As patient advocates, nurses must ensure that patients have access to all available medical information, education, and options to select their best choice. Beneficence, acting in a way that promotes the benefit of others and embodies traits like compassion and kindness. The ANA characterizes this as action guided by compassion. Justice is the idea that all treatment, decision, and nursing care should include all fairness component, regardless of patient's financial situation, color, religion, gender, or sexual orientation. Nurses are required to treat every patient fairly. Non-maleficence is to do not harm. It is the most well known of the nursing ethics guiding principles. To obtain a positive results is more explicitly choosing treatment and intervention that will cause the least amount of harm. Every nurse should ideally be familiar with these principles to practice nursing effectively daily. While ethical concepts can occasionally be challenging to understand and are frequently briefly covered in nursing school, they should always be a part of nursing practice to give all patients the finest, safest, and most compassionate care possible. Impact of healthcare policy provision on the patient's experience. The Affordable Care Act was approved and signed by President Barack Obama in 2010. 2014 saw the implementation of Medicaid expansion, which raised the eligibility requirements for all people with incomes to 138% of the federal poverty line. Since its start, the ACA Medicaid expansion impact on insurance coverage and access to care has been documented in the literature compared to states that did not expand Medicaid. As a result, This has boosted access to primary care and prescription drug while providing coverage for millions of low income customers nationwide. In addition, research has shown that uninsured people who have access to insurance have an increase in their usual source of treatment, a decrease in out of pocket expenses, and an increase in preventative health care. Nurses' vital role in the coordination of care. Through care coordination, registered nurse can improve quality and efficiency while lowering costs. This realization lead to the completion of transitional research project. The study determined evidence-based dimensions and skills which directed the creation of an RN-provided care model. The dimensions are assistance with self-management, individual and family education and participation, counseling and coaching for both individuals and families, teamwork and collaboration, person-centered care planning. Nurses play a key role in coordination of care. Through proper communication, ethical decision making, patient centered care, and education, it can be significantly improved. I would like to thank you all for your attention and time.